He started Vetsprands after 25 years in a specialist referral practice. He then headed up NOLA Ultra Dog's dog food section until 2012, where after he founded the unique vet-only pet food and product company, Vetsprands, and then VetScripts. He lectures worldwide to veterinary colleagues and laymen and has a keen interest in business, pet products and nutritional development. Okay, very welcome. I'm giving over to you.
Thank you, Madeleine. Well, guys, what an absolute pleasure to host you tonight. And we had, I think, an absolute record attendance sign up, the original sign up. I want to say to each and every one of you that I realize how extremely difficult it is after a long day's work to join a webinar like this, but we've very specifically tailor-made this webinar for you tonight, and I want to coin a new phrase tonight, and the phrase is actually taken from human medicine and human caring. And you know, in the past, whenever I've done these webinars specifically for receptionists and front staff, it's been difficult for me to really get the feeling of what you guys do and to actually make a more specific point as to what your function in a veterinary practice is. And it came to me yesterday that you are actually not receptionists, people that do the front staff, people that are nurses, people that are in the nursing section of the practice. In other words, excluding the veterinarians, you are, in my mind, caregivers of animals. And although you don't spend every single day nursing and actually looking after an animal, your advice and the way that you handle your clients, the way that you handle the puppies, the dogs that come into the practice, you are the first sight of the practice, and you are by far, in my mind, one of the most important links in the veterinary chain. So welcome to each and every one of you. I know that there are some veterinarians that are also joining us tonight, and I'll say a little bit more about that later on. But primarily, this is basically a lecture and a webinar for you, the caregivers. So for our fellow veterinarians that are here, don't expect highfalutin vernacular. Ek kan die wetenskaplike taal gooi, but I'm not going to do that tonight. I'm going to keep it easy. I'm going to keep it basic. I'm going to keep it simple. And I hope that by the end of tonight and by the end of this lecture, you'll have a better understanding of this extremely difficult disease, kidney disease, and how it actually happens and what the whole way it progresses. And how you can then give your clients, as caregivers, give your clients the correct advice on how to try and prevent this, and also on how to basically extend a patient's life. So welcome again, and thank you very much. We're above the 100 attendance already, and it's just climbing constantly. So for the people that have just joined us and maybe are a little bit late, very, very warm welcome to each and every one of you. So I'm going to start now. And I'd like to get you to have a look, or ask you to have a look at this slide, the first slide. It says understanding kidney disease in dogs and cats and the prevention and management thereof. And you may ask yourself tonight, why does this webinar host or the lecturer have this black and white slide? Normally we have beautiful slides with all manner of color and designs. I particularly chose the black and white theme tonight because it fits in so very well with renal disease, in the sense that emphatically renal disease, kidney disease in dogs and cats is not a black or white disease. It's a disease that progresses from white to gray and then to black. And it's a progressive thing. There is not a one moment it's this and the next moment it's that. It's a totally progressive disease. So most dogs, the majority by far of dogs, are born with beautiful, healthy, functioning kidneys. And then as the stresses and strains and diseases and multitudes of things happen during their life, and I actually want to take it back to aging. It's actually, age is as much a disease, aging is as much a disease as kidney disease is, because it's so closely interlinked that as dogs age, they gradually go from normal kidneys to subnormal kidneys, and in the end stage kidneys, which the Germans have really given a very good name to, calling it Schrumpfnier, in other words, shrunken kidney, when that kidney has lost its function to do what it should be doing. So That's what we have as a background. I think for me to be able to explain to you carefully and very openly and in an understandable manner what happens with kidney disease and how you can play a role in managing and preventing this, we just have to have a 2-minute anatomy lecture and explain to you that the kidney is actually a very unique organ in the body, because the kidney is made up by a multitude, and we'll have the number now, of little organs called that we call a nephron. And those little organs sit and they make up the kidney, the whole body of the kidney. In dogs, and these organs are actually there, the nephrons are there to filter the poisons and the toxins from the bloodstream. Over and above what is done by the liver, the nephrons have a major function in doing this. So they take blood, the blood will reach the glomerulus, the little organ at the top there, and they will basically filter through the glomerulus, and then the urine will go down the little tubules. And all of these little tubules in the end will go down into the bladder and form the urethra, where it goes into the bladder. But there's a very important other portion of it, and that is the collecting tubules, the one down at the bottom. As the water and the poisons are excreted, it's also a function of this glomerulus via its collecting ducts to reabsorb water and to stop the dog from dehydrating. So there's a very, very specific balance between filtrating and reabsorption. And by that way, we are actually washing out poisons without dehydrating the dog and without having to have the dog drink water the whole day. So in normal dogs, we normally have around about 400,000 of these nephrons. In cats, it's less, it's 200,000. And that's why often in cats, as pets, we find an earlier renal disease, and we find a higher incidence of renal disease as terminal diseases. So every dog starts off with about 400,000 functioning nephrons. And as the stresses and strains, and as I've explained, all of the other things happen, these nephrons are actually damaged and they die off. And it's only when 70% of these nephrons have died off, and that's the figure that was given to us as veterinarians, as students, and I believe this figure changes from time to time, but essentially when the majority of the nephrons have actually been damaged, the kidney no longer functions, and the kidney functions suboptimally. Before the 70% damage is done, you will still find that there is no clinical signs. That generally speaking, it's only when we reach this tipping point, when we reach a scenario where we will say, now the dog is starting to show illness. But the disease itself, the progression of the disease has already started way, way back before that it reached the 70% stage. So essentially, we all know that dogs start their lives as fluffy, healthy, joyful, jumping, Jimmy type of puppies, lovable animals that fill our lives and give us so much joy. But unfortunately, as they age, the ravages of age come and the ravages of disease come, very often dogs end up in this scenario where they, at the end of their lifespan, where they're on a drip, where they're completely emaciated, and where they are no longer that joyful jumping puppy. If you look at the owners of these dogs, it's another scenario, and very much the same scenario. You get this scenario where when anybody, be it a child or an older person or a middle-aged person, the owner of the animal gets this puppy, it's the most joyous thing in their life. And that joy lasts for a long, long time, depending on how long we as caregivers can actually get that dog to live and get that dog to survive. But if inevitably, all of these cases will end in the scenario of this young man sitting there crying and having lost his beloved friend. And that, as I say, is basically your function, partially your function, along with the obviously expert advice and expert care of your veterinarian. Life expectancy would grow by leaps and bounds if green vegetables smelled as good as bacon. We have to understand that the basic feeding of dogs is a major, major factor in extending life of dogs. There is absolutely no doubt that since the advent of super premium dog foods, the life expectancy of dogs have actually increased. And as a caregiver, it's your responsibility. That's your job. You cannot escape the responsibility of tomorrow by evading it today. You as caregivers are there to actually advise your clients and to do your absolute utmost to get the client to buy within his means the best possible dog food that he can. purely by just getting that done, you already will extend the life. And you will get to a scenario where you were my favorite hello and my hardest goodbye. I know so often in my practice, and that in the end was actually the reason emphatically why I decided to exit practice and retire from practice, because the hardest goodbye of my own patients and my own clients just became too difficult for me. So you there to extend that period of time and to minimize the time, maximize the time period that the dog lives with the owner, that the dog has a quality of life, and when to euthanize the dog with kidney failure or disease is extended. And in this way, tonight's lecture will show you, by going through the science of why our kidneys functions, it will show you how to actually get to this point. So renal focus and other script diets, once the disease has actually become clinical and inevitable, will make a big difference. But also what you're going to be advising your clients to feed top quality food will be the scenario where you will extend the life of the dog. And if you hear some crying, it's actually George. We're going to tell you about him a little bit later, and he's becoming a little bit difficult, so I may have to just stop for a moment and get him to exit the room. So the disease, kidney disease as a therapeutic diet, I'm basically, as I said in the past, we're talking here to veterinarians, we're talking to vets, caregivers, but this evening, as I said, is for you. I want you to understand how kidney disease works. I want you to understand how you can try and extend that puppy's life to the maximum that you possibly can. So when we look at kidney disease, it's really important for us to differentiate between acute kidney injury. In other words, not the disease as such. One of the things that will cause a dog to suddenly become kidney deficient, to develop kidney damage. As a direct cause, it's toxin injections, the melamine toxicity. In 2007, when I joined NOLA, the Royal Canin melamine toxicity was a case in point. Many dogs ingested melamine, the kidneys were damaged, and a year and a half or 2 years later, those dogs became kidney deficient dogs that actually had chronic kidney disease. It requires emergency treatment if the dog has acute kidney injury. And very importantly, it may disappear completely once the underlying cause is treated. But it can also, and in many cases, leads to permanent kidney damage that becomes progressive. So then the acute kidney injury goes over into chronic kidney disease, CKD. And we finished with acute kidney injury now. The 2 minutes that I spoke about it, that's as much as I'm going to be telling you about it. That's the cause. That's the original insult. And it can heal itself completely or go over into chronic kidney disease as such. What's a chronic kidney disease? It develops slowly over time. It can present from birth if there's a congenital disease, and as a result of a whole lot of other disease conditions that were as part of AKI. The clinical signs do not appear until later, when the stages of the disease gets to that point. Remember the 70% that we spoke about. Treatment depends on the stage of the disease, and that's hugely important. And you'll see later that we stage the kidney disease and then decide what the best treatment is. And it depends then on what you're going to be prescribing and what you as caregivers are going to be playing a role in actually trying to prevent this disease from progressing too fast. And very importantly, the most important single point that I will have to bring across tonight, or would like to bring across tonight, is that it has no cure. Kidney disease has no cure. Chronic kidney disease, you can only extend it. It's exactly the same as arthritis. Once a dog has arthritis, it's progressive, it will progress, and it will get worse and worse. And you'll get to a scenario where the dog will go into end-stage kidney disease. But we want to try and maximize the time from the injury until the dog gets to the end-stage kidney disease. So it's the silent enemy. It's the normal kidney that turns into the Schrumpfknie. And we want to tell you later on how you can actually prevent this once the disease is started, by using Reno Focus or another script diet correctly. Our diets, the Vets Brands diets, we call therapeutic diets. The other American company, Hills, calls theirs script diets. Essentially, they're all the same. They're diets that have been specifically developed to manage, control, and reduce and extend the life expectancy of dogs. So chronic disease, kidney disease, let's just quickly read through it and then finally put it to bed so that you understand. Chronic kidney disease or chronic renal failure is a progressive and irreversible syndrome. Syndrome, not only a disease, it's a syndrome of reduction in the renal capacity. So the renal kidneys reduce their capacity to work, eventually leading to death. So every single case, if the dog doesn't die from another cause, will die of kidney disease. When enough of those nephrons have been damaged, it's emerging as one of the leading causes of mortality in the world. So you're, again, reiterating what we want to do as caregivers, what we want to do as veterinarian, is to actually ensure that these two old dogs that's sitting with that beautiful lady will still be there when she has a little bit more wrinkles and when her body is not as firm and tender as it is at that in the picture. So we want to try and give the owner the time, maximum time with his beloved pet. That is what we want to try and do. This is an article that, published from 1984 to 2004, the most important causes of mortality, and definitively urogenital diseases, kidney diseases, is way up there. So we know it's a major, major cause of death in dogs, and especially in old dogs. And we also know now that we can actually reduce that and extend the time of disease, of survival. I'm not going to take you through each of these points of the rationale for kidney disease specific diets. There's a whole lot of work. It was done as early in 1991 when a veterinarian, Dr. David Paulson, and the guru of kidney disease, Charles Osborne, Professor Osborne, published this study where they proved emphatically that dogs that are on the correct diet and renal diet will basically have less incidences of uremic episodes. In other words, will have less incidences of showing the disease, of showing the symptoms of the disease. So you'll see the kidney diets, the blue and the things like the blue actually had far less than the dog that basically was not on a renal diet. And the same thing with mortality. In mortality, the dogs that weren't on kidney diets, on renal specific diet, tended to die far quicker and far more easily. So effectively what we're saying is you want to try and major scenario where you can reduce this disease progression is via nutrition. And it will be absolutely the ideal if everybody has the time, money, and effort to actually go and make up a very specific diet via a cooked diet, home cooked diet, home prepared diet. Practically, that just isn't possible. So we, in most 95% of cases, people feed dry dog pellets. They do feed a dry extruded diet. And we want to optimize this dry extruded diet in the way that it's formulated, in the way that it's manufactured, in the way that its ingredients is actually included, to make sure that the dog has 13 months longer survival time. Emphatically been proven that dogs that are on a renal specific diet will live up to 13 months longer once the severe symptoms have started than dogs that are on a normal maintenance diet. 33% of dogs will die within 2 years, basically if they're on a renal diet, and 65% of dogs will die in 2 years. So both the mortality rate and the morbidity rate is influenced very, very strongly by a renal diet. So this shows emphatically to you guys that yes, there is a place for renal diet. And I've spent quite a lot of time on it just to reiterate and to make so sure that you understand that there is a place for a specific script or a therapeutic renal diet. And now we're going to try and show you how you're going to use that renal diet. When do you use it? How are you going to be using it? So we spoke briefly earlier, and when we look at kidney failure, we stage them in stage 1, 2, 3, 4, and some of the people actually go to a stage 5. And all of these are basically determined by certain blood tests. And those blood tests is the work of your veterinarian and the veterinary nurse and the highly qualified person. You are not going to be involved in those blood tests. You're going to be involved in the clinical symptoms of these dogs. It's your work to actually tell the client and to inform the client what are the clinical symptoms and what he must start looking out for. So when the older dog comes into your practice and it's not overrun at that moment in time in your practice with clients, and you've got time to talk to these clients, a 6, 5, 6, 7-year-old dog, take the time and explain to that client that it's so hugely important to start with a senior diet, correct high quality senior diet, and start asking the questions of what we're going to be telling you now of the symptoms. So you can play a major, major role in early detection and early prevention of kidney disease. And you can very often also say as your caregiver, as the caregiver, that you would strongly recommend that the dog has routine blood tests, which your veterinarian will then perform to determine, because there are really specific and incredible blood tests now that the veterinarian can perform, common diagnostic tests, and a whole lot of them that can actually pick up early kidney disease far better and far earlier than when I started in practice many, many years ago. So you can talk about the blood tests, you can talk about the specific diets and the high quality diets. And you've got to alert your older client about this horrible disease called chronic kidney disease. So that's your job. So let's start then and look at stage 2. At stage 1, there's normally no symptoms whatsoever. When the dog gets, you'll only pick it up by these very specialized blood tests. But in stage 2, and it's also important to say, whenever we as veterinarians put things into stages, we actually have this definitive table, stage 1, 2, 3, and 4. And we have to understand that there are gray areas. So it'll gradually progress from 1 to 2. So there's a 1.5 and a 2.5 and a 3.5 and a 3/4. And there's nothing that's completely in boxes. A dog doesn't read the manual. The patient doesn't read the manual. They don't know when they're in stage 2, this is the symptoms they should show. So they just to give you some sort of indication of where the disease lies. So in stage 2, the symptoms are, and I saw that so very clearly with little George that's sitting here with me now. He's now 13 years old. He was absolutely perfect. There was nothing wrong with this little dog. We went to America for 5 weeks on a business trip. I had his teeth scaled a few months before the business trip. And whether it's the stress, whatever the cause was, he was in early kidney failure. And to my absolute shame, I have to say that I didn't pick it up in stage 1. When we got back, it was like a hand turnover. It was day by night. I got back, and when I actually walked into the house, normally it would go ballistic. You cannot believe how this dog can scream when I arrive at home. And he was just lying there with this dull look in his eyes. So effectively, the first and major symptom that you need to tell your clients about is this dullness, this loss of energy, the loss of livelihood, and to look for dullness and that dull look in the eyes. The next thing is very, very clearly, and that's a typical symptom that you can alert your clients to as caregiver. The dog will start drinking more water. And it's definitively not a case that a dog that is drinking more water has only kidney disease. We know that diabetes and many other diseases can and will also cause this. But that's the alerting factor. Tell your client, if you've got a dull dog and it's starting to drink more water, please bring the dog in for blood tests. Please, let's decide and make a decision whether he's in early kidney failure and stage 2 kidney failure. Then it'll progress. So from stage 2, it goes to stage 3. They're still drinking a lot of water, but lo and behold, they're suddenly starting to do strange things. Sorry, mommy, I had to go. I just couldn't keep my pee-pee in. My bladder was so full that I just had to do it. And the first evening I got back from America, George slept in the bed with me, and the caregiver that we have, our PA, told me, it's very strange. I've actually found George wetting the bed once or twice. And that very first evening he slept with me, he actually wet the bed. So this is the next stage. Once the dog has inappropriate elimination of urine, it's a major red flag. Drinking too much water, starting to wee in the house, starting to maybe, if he sleeps in bed with you or with a client, starting to have inappropriate urination. Very, very important symptoms of stage 2 to stage 3 symptoms. Stage 3 and 4 to stage 4, you have all of these other horrible things. It'll still be dull. It'll stop eating. And in my case, in George's case, stage 3 was already anorexic. So in stage 3, the anorexia was quite pronounced as well. So that's another thing that you can very clearly tell your clients. If he drinks too much water, if he urinates too much, and he stops eating or his appetite decreases, red flag for kidney disease. Weight loss, anemia, vomiting, too much drinking and urinating, black stool, and then end stage where you have the urinary smell, the uremic breath, and even mucosal ulcers, and this really sick dog. So there you can see the photographs. By that stage, it becomes very, very difficult to slow the disease down. Now we can only manage the disease. We can no longer slow it down. So stage 1, 2, 3, we can slow down. Stage 1 and 2 specifically. Stage 3 and 4, you can just manage. You've lost the window of opportunity to really extend that dog's life. And that's so important to understand. So I will do anything for love. As I said, the ideal would be, and if you excuse me for one moment, he's just getting too difficult. So I just want to put George outside. He's going, give me a second moment, please, guys. Sorry. Right, I'm back, and sorry about that. I think he's heard this lecture so much as I practiced it that he's becoming a little bit bored with it. Okay, so I'll do anything for love, but I won't do that. Most people will not be able to home cook, home prepare a kidney and a renal diet. That's the first thing. Secondly, it's so important if they do it, that they do it correctly, and they'll need a veterinary nutritionist or a veterinarian that has really good and solid knowledge of home cooking and wet diets, soft diets, and frozen diets to advise them. It's not recommended. It's far, far better to actually use an extruded pellet that's a therapeutic or a script diet. And basically, we're going to look at Reno Focus, obviously, at the end as our offering as one of those script diets. So what's the nutritional requisites of a renal diet? What does a renal diet really need? And now it's important to start listening carefully. The previous 20 minutes, 10 minutes that I've spoken to you have been more about explaining the disease. We're now going to say, what do we want in this renal diet, in our therapeutic diet, in our script diet? What is the ideal? So we want all of these things, and I'm not going to go down the list because we're going to talk about very briefly, 2 minutes about each and every one of them. Definitively, we want to say, do we tick all of these boxes? Does a nutritional, therapeutic, or script diet tick all of these boxes? And we're going to be looking at it. So there is absolutely no doubt that protein restriction reduces morbidity, in other words, symptoms, and mortality. It extends life, and it basically reduces the symptoms as well. And in each of these points that I make, when I give this lecture to the veterinarians, and again, my apologies for you as colleagues that have joined us, when I do this lecture to veterinarians, we'll go through each and every little point, and I'll give you scientific background and scientific points. Every time I'm going to make a statement now, you will see that at the bottom of the screen, the article that I've referred to, or articles, are actually listed there. So the reduced protein renal failure diets were of benefit in preventing or reducing morbidity and mortality. That is the take-home message. We know we need to restrict protein. So we can't go to the 30, 23, 24% protein. We want to restrict protein. We know that protein restriction will actually get dogs to gain weight again. That's been proven again and again. So that's the clinical observation. Blood test wise, we know it works. On the clinical side, we know it works. Let's look at quality and source of protein. Hugely, hugely important. You cannot reduce the protein content in the diet and stick to bone meal and carcass meal. You have to increase the quality of the protein. The amino acid profile of whatever you're going to be giving, the building blocks of the protein, has to be optimal. So essentially what we want is we want preferably chicken or turkey. We've clicked that to tick that box. We want, as part of the renal diet, egg. It's got massive advantages, some disadvantages, and we need to just formulate correctly. And then, of course, we basically want cold water fish such as Manhattan and deep water fish, cold water fish, and then salmon as a major source of nuggets. So those are the major protein sources that we want in our diet. Okay. When we look at minerals, there's phosphate, potassium, sodium, calcium, and bicarbonate. And this is what we want to do. We want to reduce the phosphate because that reduces the load on the kidney. So the phosphorus needs to go down in the food. The potassium needs to go up because the dogs lose potassium through these damaged nephrons. The potassium actually is washed out. So these dogs all become what we call hypokalemic. In normal words, it becomes deficient in potassium, in potassium. And potassium has major role in the well-being, energy, and in many other areas of health of patients, of dogs and humans. The sodium we want to reduce because the blood pressure in all of these dogs that has kidney disease will basically increase dramatically as one of the symptoms, measurable symptoms, and sodium plays a major role. So if the blood pressure goes higher and higher, the kidneys are damaged more quickly. So we want to reduce sodium. Calcium, we monitor because calcium is sometimes up, sometimes down, and it all depends where it's lying. So that's what the blood tests that your veterinarian is going to be doing, serial blood tests. If the client really takes this disease seriously, you will bring the dog in for the first test, and it'll go over every 3 weeks, 6 weeks, whatever your veterinarian decides. The tests will be done, and you'll monitor calcium. And then, very importantly, we all now know that we have to increase bicarbonate. They all become acidic, these dogs, and we need to, in the diet, increase the bicarbonate. And again, we've ticked every single one of those boxes in the script diets itself. What do we do on the vitamin side? Essentially, they've proven emphatically that the blood level D and folic acid will basically drop in dogs that have end-stage kidney or chronic kidney failure. So essentially, we want to give foods high in vitamin D, and we've clicked most of the boxes by actually ingredients that we've spoken about before. And then I said, again, we're ticking the boxes because we're using these foods that are high in folic acid. But again, over and above just the ingredients, we will actually add this to our therapeutic diets, and we'll talk about that again. And then on sodium bicarbonate, we can't really do much with that on the food side, ingredient side. So that is something we'll need to add to the diet as baking soda and high quality sodium bicarbonate adjunct treatment in our vitamin and mineral pack. Okay, so we're increasing the bicarbonate. And then very importantly, one of the most important factors in extending the life and slowing and the progression of the disease is the importance of the polyunsaturated fatty omega-3 oils, so the good oils, okay? And again, we need to omega-3 acids, and we're doing that again by all of these. Okay, so we're ticking the boxes again with the fatty acids, and we're ticking it primarily with a salmon oil that we add, and we're ticking it with our high quality fish oils that we add to the food. And then with things seed and flaxseed. So all of those boxes are ticked, but very importantly, and this is quite new information, is omega-3s. We've now finally found that it's also important correct amount of omega-6s. So we mustn't discount omega-6. The ratio is important, but the omega-6s also need to be there. Not in high numbers, because we need animal and deep water fish omega-3s much more than the omega-6, but we don't want the diet in the canola oil in the omega-6 aspect. Okay. The good and bad bacteria that sit in the intestine, they've proven emphatically that dogs on script diets, correct therapeutic and script diets, will actually influence this microbiome, increase the good bacteria, reduce the bad bacteria, and in such a way have an influence in extending life expectancy and reducing symptoms again. And then very important, betaine and soluble fibers. And this is really quite new. It was published in 2020. They basically did a study where they examined the effects of foods with added betaine, which is basically vitamin the precursor of vitamin B15, and then fibers, correct fibers. And emphatically found overall foods with added betaine and soluble fibers showed positive effects on the plasma and the fecal metabolomes. So basically it has an effect on blood tests, and we have an effect on the good bacteria. So the betaine and soluble fibers are really important, and not all of the script diets actually tick this box, I have to say, unfortunately. Okay, so that's your betaine, and we get the soluble fiber by way of the beet pulp, which is a very specific fiber that would be added to all of these script diets and the therapeutic diets, and we tick that box in. Then we're having a look at the combination of renal diet with nutraceuticals. And exactly as I said when we spoke about arthritis, and when I gave a lecture about arthritis, we've got to understand this is a progressive disease, and it's a disease where it's often just not possible to add enough of the nutraceutical additives. Nutraceutical support is something that, unfortunately, in many cases, we just cannot do adequately by way of a diet. And that's what really makes the way that we handle as vets brands this disease a little bit different. We're combining renal diet with evidence-based renal nutraceuticals. And in doing so, we're basically getting the absolute optimal therapeutic diet. We even on the tubs that we are supplying with RenoFocus food, we say that this should be used with a nutraceutical additive, and that additives we'll be talking about later on. So effectively, when we look at our product offering at RenoFocus as a product offering, it's basically currently supplied as a 3 kilogram plastic tub. It will be available in 8 kilograms and 12 kilogram bags as well in the near future. And effectively, I just want to reiterate again that obviously this is a therapeutic diet. And as with all of our diets, every single one of our maintenance diets, this will be a veterinary only diet. It will only be sold by veterinarians. We know that some of the other companies, and in particular the company that I'm going to be comparing ourselves to later on this evening, basically reneged on the vet-only concept. They went into supermarkets, into specialist pet stores. Currently, the script diets are still within the realm of veterinary science or veterinary practices only. We as VetFocus has always maintained that we are vet-only, that we sit and we prioritize the needs of your pets to be exclusively vet-owned company that supplies our product exclusively via veterinarians and vet-owned vet shops. So the RenoFocus, this is what the ingredients list, this analysis, etc., looks like. And we're going to be looking at the leading American company, which supplies a script diet, and ours product that supplies a therapeutic diet, both for the treatment and the management of chronic renal disease. So when we look at guaranteed analysis, and again, I'm not going to take you through each and every one of these, but effectively, if you look carefully, and you can go and do it, if you do have RenoFocus on your shelf, go and take the RenoFocus tub and compare the guaranteed analysis of the American script diet to ours. Essentially, we are extremely close. And where we do differ in the protein, the one reason why we've got 13.7% protein and then they declare 15% is that we do not declare the protein value of the legumes, of the plant proteins. This declaration of 13.7 is purely the animal ingredients in that food. The fat's very much the same. On all of the others, we're very much the same. But on the omega-6 fatty acids, we've increased it slightly, taking into account the newer science that the newer reports that we've had on the on the new reports that's been done via the publication that I told you about. So we've increased the omega-6 fatty acids ever so slightly. So essentially, if you look at the ingredients, we are exactly the same. They declare fish oil 1.6%. We have a 2%, but they don't declare what fish oil they have. Ours is essentially every single one of the fish oils that we use is cold water, deep sea fish oils, and salmon oil. Only declare meat and animal derivatives. We declare that we do have turkey protein meal as the only source of an animal derivative. I could not find a specific animal derivative declaration in the American food, but I can guarantee you that we use exclusively turkey protein meal for the specific reason that that's one of the high quality imported protein meals that is readily available from overseas. So we have a standard supply of that. And then we basically declared also the whole dried eggs and pea protein, which is in the same realm as the American product. So essentially, ingredient wise, very, very much the same. Beet pulp, beta glucan, and betaine, those soluble fibers and the betaine, we have as an additive in our food. And basically that gives us the better microbiome that we looked at earlier. I'm not going to go through this. I'm going to summarize it and say the clinical claims that we're making is that we're reducing the workload and in such a way protecting the renal function. We're reducing progression of kidney disease. We help control clinical signs. And very, very importantly, we enhance appetite and increase food intake. And this we do by our incredibly, incredibly high quality proteins, but more so we do by a very, very specific coating of the food with digested ostrich liver, the highest palatability food enhancing amino acid blend that you can get. So it's not a synthetic enhancement. It's made from livers of ostriches exclusively. And this is our appetite trigger enhancement. This is our product that actually enhances the appetite. And this was taken just this morning. George is back to eating. He's eating much, much better than he did when I just got back. He loves the Reno Focus. He's on the Reno Focus diet. However, in some cases, you still need to add something. And this will be a completely separate lecture that I'll be giving you guys in the next few weeks or early next year. How can you get your inappetent dog to actually eat better? And the very strange thing that happened with George this morning is that he didn't want to take his food again. And my wife said, take him into his quiet sunroom. And this sounds really corny and it sounds really silly. He didn't want to look at the food. And I took him and put him in the sunroom where he feels safe and he loves lying in the sun. And the next moment he started eating, and that's him munching away happily at his Reno Focus now. So there's a whole trick and there's a whole way of handling the inappetent dog and the dog that's not eating well. Because remember, we're now giving these dogs less protein, higher quality protein, and we've got to ensure that these dogs take the correct amount of food every day. So how does it work? Basically, it's controlled phosphorus. It's reducing the protein load. We're optimizing the protein quality. We're reducing phosphorus intake. We're optimizing the mineral and trace element intake. We're adding the omega-3. We're adding the appetite enhancing, and we're adding very specific nutraceutical elements. We really are ticking all the boxes that we looked at previously. And these are our unique additions that we then add to our food. Feeding guidelines, when you compare the American product to our product, exactly the same on a kilocalorie basis. We have within a 98% same kilocalorie per gram. So the feeding guidelines, which is completely and fantastically well designed and maintained by the American company, we've used that feeding guideline 100%, and we're getting perfect and really good results. So you do not feed your dog more when you're feeding it Reno Focus than when you're feeding the American diet. But this is the kicker, and I want us to stay with this for a little bit to actually just look at this carefully. It's hugely important to understand that when your client is buying the American food, he is buying in dollars. So for every $1 that they have, we need 20 Rand. I was in America for that extended period, and I cannot tell you how difficult it is for a South African to stay in America and have a Rand-based income. So the Rand basically has a major influence. The importing costs has a major influence. Remember, they have to import every single raw material that is in that food. None of it is available in South Africa. We're importing the proteins, we're importing the oils. The rest are sourced from South Africa itself. So what's the take-home message? A 20-kilogram dog cost per month would be in the region of 1,460 Rand with their American diet. Ours would be 1,040, and we've looked at feeding a 3-kilogram equivalent of their bigger bag. So it will become even better when we have our 8-kilogram and 12-kilogram bags. So almost 30% saving. And this now makes it again possible for your lower and middle income group to give their dog the maximum benefit of a fantastic script diet with some additional benefits to the others at a very much more affordable price, back at what the old American diets cost 2 years, 3 years ago. So I think there is absolutely no reason why you as caregivers, why you as veterinarians in your practice shouldn't have a very careful look at Reno Focus and actually see whether it's not worth your while considering using our product. Then I just want to very briefly stop at the pet supplements. We said that we offer the Reno Focus oil and we offer the Reno Focus tablets. So the Reno Focus oil is specifically designed and developed to actually get to the stage 2 to 3 stage to enhance the life of the dog, to slow down the progression of the disease. So that's before the dog becomes hypokalemic, hyperphosphatemic, before his potassium has dropped, before his phosphates have jumped high, before his blood pressure has actually gone up. Then you give them the Reno Focus oil, which is based on very, very specific krill and salmon, high omega-3 values, and then very importantly has added coenzyme Q10, which there is a very specific and incredibly good scientific article, evidence-based article, that coenzyme Q10 will slow down kidney disease and actually strengthen cardiac function. So both for the heart and for the kidneys, the Reno Focus has a massive effect in slowing down the disease. So you'll start using your Reno Focus in those stage 1s where the SDMA, where the blood tests have just shown that we're in early renal failure, and you start using that along with your senior food, or when you go over to your renal diet with the Reno Focus in the early stages with your Reno Focus as the oil. And then very, very importantly, you basically look again at the scenario of the Reno Focus tablets. Remember quite a few slides back, we said specifically that there was work done on slowing down the disease and actually increasing the survival time of dogs that were on this exact same formulation that Reno Focus tablets are. So the Reno Focus tablets, absolutely mandatory in my mind, needs to go along with whether you're feeding the American diet, script diet, or whether you're feeding our therapeutic diet, the Reno Focus diet. It's hugely important that if it's the dog in the owner's life, if that owner wants the last 14 months or the last 2 years with their dog, that you add the Reno Focus tablets. In the near future, we will have that as a very, very palatable powder as well. We finalized the formulation. This powder that's got everything that the tablet has got in will actually be an added benefit as a gravy to enhance appetite even further, and to actually entice the dog when he's getting to this anorexic state where his appetite has gone right down, to entice the dog to eat. So early stage kidney disease, senior food, high quality senior food, little bit later, renal script or therapeutic diet plus Reno Focus oil. Late stage, when the dog's starting to show severe symptoms, stage 3 and 4, Reno Focus food, then with the Reno Focus tablets. And we are absolutely unique in actually offering this combined treatment modality and prevention modality. None of the other companies in South Africa, be they imported companies, none of the other companies can offer you the full package. And I'm incredibly proud that we as Vets Brands was the first company in South Africa to do this. As with many of our other nutraceuticals, I'm sure the copies will follow, but currently we're the only company that actually offers it as such. So Reno Focus diet with Reno Focus oil or Reno Focus tablets. And in such, you will be optimizing health and survival time, hugely importantly, at an affordable price. Okay, so it's been not a very long lecture. It's been a lecture filled with facts. You can go and watch the lecture again. It will be available on the normal link that VetLink supplies to us. I hope that this has tweaked your interest. I hope this has made you understand that there is so much more that you as caregiver can do in actually optimizing health and extending the life expectancy. So Madeleine, if you, I see that we've got 44 chats and I can't see them. I was too scared because I'm so deaf. I was too scared to go into the chats. Can I go into the chats now? And the questions and answers, or will
Yeah,
you read them?
so it's not, yeah, it's in the Q&A. There's nothing in the chat, but I can read it to you. You can click on it, okay? See if you can
Okay,
see
so
it.
quick on the
On the
questions and answers.
Q&A, yeah.
Okay, right. Is Björn merely a marker or a driver of the pathology? Okay, so Duncan Wigworth. Hi, Dr. Duncan. We still have to talk about your other tablet, but in any case, I'll give you a ring. So BUN is not a very sensitive test. You can, it's normally only when you go way beyond that 70% damage or more that the BUN starts going up. So in my mind, it's more a marker of the disease. The SDMA and the urea protein ratio is the one that you want to use in early in actually making the decision. Is there protein losing via the kidney? Is there protein nephropathy where there's protein loss? And the SDMA will give you a far quicker and a far earlier answer to whether the dog is starting to go into stage 1 and 2 kidney failure. So I hope that answers that one. Will RenoFocus prevent kidney and bladder stones, and how does it compare with other script diets with regards to that? Excellent question, Dolene. No, absolutely, definitively not. It's not indicated for bladder stones. Those are very specific diets where you actually need to analyze the stone, and that's where Carl Osborne, many years, did this groundbreaking work. I remember he was here in South Africa as a veterinarian lecturing, and we basically, he had a very specific little booklet that he gave out. So no, it's not indicated for kidney stones. It's for chronic renal failure, chronic kidney failure. The question from Janine is, can we start the dog immediately on RenoFocus diet, or should we also give a week or two for the system to settle? Okay, great. Again, a really good question. Once the dog is in stage 3 or 4, you don't need to transition, and because normally then the dog is so anorexic. So in George's case, we basically started the moment I got back, the moment we got the blood tests back, the moment we got the definitive diagnosis, we changed him immediately from what he was on the normal senior dog food. We changed him onto renal diet. And it just was absolutely dramatic, that and the other support of the RenoFocus tablets, how quickly, within 2 to 3 days, the transition actually happened, and how quickly his symptoms actually started disappearing and he started getting better. So in early stages, you can transition if the dog's been on a senior diet and you want to transition just to basically extend life. You then can go 50% and transition slowly. But in the later stages, when the dog's got acute symptom or has symptoms, really bad symptoms, you start immediately with the RenoFocus. So as I said, just to come back again, Sana, my wife, is sitting here and pointing a finger or showing me the finger and saying, you've got to explain better how to get these dogs to eat. And as I said, we will be doing this. I think it's a really difficult subject. It's a complete subject that we need to discuss. But essentially, in some cases, you will need to actually put something over the food. And by far the best is to actually use ostrich mincemeat and actually braise that ostrich mincemeat so that it gets slightly warm and make a little bit of a gravy of it. You can also use high quality salmon and actually braise the salmon and mix in your RenoFocus tablets into that, and that will often, and in George's case, that made a big difference in the first day or two. But there's a whole sort of science to actually doing this, and I will be discussing that. Luckily, the RenoFocus food is truly palatable, and in many cases, the dogs will just start eating again once you actually offer them the RenoFocus. Madeleine, have we got more questions?
I see Teresa put up her hand. I did allow her to speak. If she wants to ask a question, she can unmute and quickly ask a question. But I don't know if it's an accidental hand. Um, did you answer Janine Parsons?
Yes, I did. On the immediate transition or not.
Okay, I don't see any other questions right now. Wait, in the chat. Oh no, there's just a few thank yous and saying they are looking forward to the product. Right. That seems to
Okay,
be all.
so thank you very, very much, everybody. We're going to have a nice little surprise now, but I just then want to, in conclusion, say that the Reno Focus is available from Locato and from VetServe. Currently, as I explained, in the buckets only. And look at the quality, go and compare it to the American products, go and compare the price, and do yourself and your client a favor and just give us a chance. The cases that we have, the cases that have transitioned, we haven't had a single negative report, and we've had a lot of people coming back, receptionists, people coming back. Our own representative has a fantastic story about Reno Focus, where a dog went in for a dental scaling, and it was actually a tumor of the mandible. And just by adding the Reno Focus or giving the Reno Focus, it went from a totally inappetent dog to a dog eating again. And that dog definitely has found great advantage in Reno Focus because there was some underlying kidney disease in that case as well. So I truly am proud to be the first South African company to offer a real prescription diet, not a support diet, but a prescription diet. And we specifically went to kidney diet because we know that this is the devastating disease. This is the one that will kill the dog in the end. And we believe that it's our responsibility to be first in this and offering an affordable alternative for veterinarians and caregivers in actually doing the utmost for these cases. Madeleine, I think we can then go to the next, or just tell the guys about our little surprise. It may not be so much of a surprise, but we decided to offer, again, a competition for everybody. And I see we've still got 160 people, which is just absolutely fantastic. And again, I'd like to thank each and every one of you. So Madeleine, will you take over for the draw then, please, and just tell them a little bit about the prize?
Sorry. Yes, so it is a trip to a penthouse at Lake Pleasant, at the Garden Route. And it includes a free night stay for two.
It's actually now a 4-night stay. So Madeleine, that was the old poster. So just to say it's a 4-night stay, yes.
Okay, wonderful bonus. And then 1,000 rand to use towards car hire, public transport, dinners, use of a bass boat and fishing gear. So yeah, guided fishing, photographic tour.
And then return flights from Cape Town or Johannesburg, or otherwise support for the traveling. So that really is a prize in excess of 30,000 Rand. And it's just my way of saying thank you for attending. Thank you for actually supporting our product. And also in saying that we really appreciate each and every one of you. And I think there's a lot of the ambassadors, the Vets Brands ambassadors also on the group tonight. And there is something really, really exciting coming in the next few weeks for you as caregivers that will be added to our offering as Vets Brands. So
okay,
so
I'm quickly going to do the spin here.
So just to explain, Madeleine puts each and every one that is still on the spinning wheel. It's electronically handled. We can't influence it at all, and it picks a number, and that number is assigned to you as a attendee. And Madeleine, break the tension and tell us who it is. Have you got it already?
No, just a second. I just need to get that number on the screen. Wendy van Heerden.
Say again.
Wendy van Heerden.
Wendy, well, wonderful. It's for you and your partner, and we're so looking forward. It would have to be in the new year in 2024. Obviously, most of the bookings and stuff have been made for this year, but get into contact with your representative or phone me directly or WhatsApp me. Is Wendy still here? So if you can
Wendy,
just
if you
post
can just quickly post your number in the chat to confirm as well. Oh, please, Finder, if Wendy can quickly post her number in the chat.
There we go. I see your name is up by Madeleine. So Wendy, if you unmute, you can just perhaps say a few words. That'll be wonderful, and then we can say goodbye. There we go. There's a telephone number. I don't know if you feel that you'd like to say something quickly.
Hello, I'd just like to say thank you very much.
It's an absolute pleasure, and we'll see you here soon next week. Okay. Thank you, guys. I think that's it. We're going to end it here, and we'll keep you posted with new products that's coming out there. Definitely, this is the first of many. We hope to, in the end, within the space of a year to 18 months, have a full offering of veterinary script diets. That is my last goal post, and we're all working very hard to actually make that a reality. So, Madeleine, from my side again, to VetLink, it's always an absolute pleasure. I've never ever had a case where things have broken down on your side or where you haven't been the ultimate host. Poor Madeleine and Parsons, who helps her in the office, had a hell of a time of it from last night to get me. It's completely pre-computer to just get my camera on and get that working. So the patience that they've shown to me has been exceptional. So thank you, Madeleine, and thanks again to each and everyone. And with that, we'll say goodbye.
Good evening, everyone. We'll send out the recording tomorrow. This webinar has not been created for CPD, but I actually think Dr. Botha didn't want to accredit it, but I think we might be able if I look at the scientific content, but it has not been submitted for CPD at this stage.
Are you saying that you will submit it and see
I
whether we
think
can
so.
get it?
Yeah, I think so. Okay. If I look at the amount of information that there is, I think we might be able to submit, but I know you didn't want to. Okay, but good evening, everyone.
I didn't want to make the promise and renege on the promise.
Yeah.
So that'll be fantastic.
Yeah, we'll submit, and if we are successful, we'll let you know. Thank you, everyone. Have a lovely evening. Bye-bye, Oki. Good night.
Thank you, Madeleine. Thank you, everyone. Bye-bye.